Hi, this is Dr. Joy Wilson with Simply Revered, and I just wanted to share some tips on how you can get the most from your clinic visit. So, one thing is you having that CMO type of attitude, feel, because essentially you're making the decisions for your health and your path to be coming well or maintaining your wellness, as well as you want to have a great collaboration with your medical provider. The other thing is, what's your strategy as a CMO, this whole chief medical officer? Because you are that, is that you want to get clear on why you're going into the clinic visit. And you want to have a specific reason as to who you're going to see, if it's going to be your primary care provider at that time or a specialist. And then take notes, like prior to the visit as well as during the visit, because you want to sometimes like where things are getting rushed and you want to avoid that principal office syndrome where you all of a sudden just forget any questions or just simply sit there quiet or having minimal interaction and someone's just telling you what needs to be done next. And then questions for you. I'm just curious, like I'm curious as well as you need to ask yourself that. Like, do you avoid going to the doctor's office? Do you get nervous while at the doctor's office? Do you feel rushed while you're with the doctor? Does your doctor demonstrate compassion? Like, these are things to ask yourself. And if you're getting anxious when you're thinking of the responses to the question, well, address that now before you go into your next visit so you can get answers and you can feel comfortable and just be well because it's all about peace of mind and feeling well and being well. Now, one aspect of the doctor's visit is, hey, we're recording all this, so it's the objective component. And if you head over to Simply Revered, there is an essential guide to having a stress-free doctor's visit. So take a look at that. I go in more in detail about the whole doctor mindset. So one thing in particular is that we're taking measurements, your blood pressure, your weight, your height, your pulse oximetry, and pain. And the blood pressure, if you're seeing that it's a little bit higher or lower for you, well, just ask and like, hey, can it be repeated? Hey, let me lie down. Let me elevate my arm. Because these are decisions are made off of these numbers that are being recorded, okay? And the same thing with your weight. We're not trying to shame you. A lot of medications are based off of weight, as well as kind of gives an idea too of like the whole BMI, body mass index, although it's debatable as to whether to use or completely uh, shy away from it or use it. It can help us, kind of give us an idea of like any metabolic predispositions or how you're doing. And the same thing with height, it gives us an idea of like, hey, are you losing some height or what? The other thing too is if you have a cough or you're getting short of breath, we need to have an idea like what's that oxygen level? I mean, it's a rough estimate, but it does give us an idea of how your lung function is. Or not necessarily lung function, but how you're doing if you're coming in with respiratory complaints. And then what's your pain? That this part is really difficult, even for me, when someone gives me a piece of paper with pictures on it. But if you could do your best and share and how you're feeling, specifically pain related. Um, Another thing when it comes to doctor mindset is that we're thinking about a plan. Like while we're talking to you and examining you, we're coming up with a plan, and then ideally this needs to be communicated to you too. So what we do recommend based off of uh, possible diagnoses for the issue that you came in with, and then if we're going to prescribe some medications or supplements for managing your initial issue, what are they? And if we're going to order some diagnostics such as x-rays or CTs or MRIs or barium swallow studies or pulmonary function tests, well, what are they and where do you need to go to get them done? And then if you need to be referred to someone, have an idea of like who you're going to see and why. Because seeing a PT, physical therapist versus occupational therapist is very different. Like you have a large muscle group that's affected. That's the physical therapist. You really value their management of this issue versus like a hand injury, like carpal tunnel issues or trigger finger. You might want to visit an occupational therapist. They deal with the more fine motor issues or smaller muscle groups. And then That's why I wrote down speech and counseling, just speech therapist specifically. Where are you going? Who are you seeing? And then it's helpful to have follow-up. I know with electronic medical records, there are patient portals so you can type, and sometimes it depends on your provider whether they're going to communicate with you that way or by phone. But sometimes the best way is just a sitting, once again, in the room and communicating. So there's no uh, questions or gray zone issues that arise with the phone or emails. So just make sure you get your results. The other thing too, when it comes to labs, if someone says it's normal and you're still not feeling your usual self or back to your baseline, you really got to ask, is it normal for me? Because I've seen people's labs be normal, but they're still having like a ridiculous amount of leg cramps. So their potassium, although it's like 3.5, it's low for them. The other thing is, so you had a chance to speak and your questions were answered and you were examined to make sure you're actually touched, like your heart is examined, your lungs are examined, because that's the best, like that's the way to get to the bottom line of what's causing your issues. You just got to make sure that you're getting the most out of your visit. So you are having a physical exam, your questions are being asked, that plan is discussed with you. Anything that's prescribed, whether any like increase in amount of water or decrease the amount of water or sodium, too much or too less, or any prescription medication, well, why is it? And then if you are going to take a prescription medication, then do you need to take a certain vitamin because it may be lowered while taking this prescription medication? And pay, like I said, pay close attention to the labs. So these are just some basic ones that you'll see on your lab report. A BMP, a basic metabolic panel, and it gives us a glimpse into how your kidneys are doing and what's your blood sugar at the time when the blood was taken. And then that CO2 is like, can actually tell us like how, if you're acidic or how your breathing is. Often if we're not taking in breaths, our CO2 level can go slightly up. Um, the other thing is the CBC, so the complete blood count. I didn't put all of the values or the abbreviations, but it's a hemoglobin hematocrit. And I like people to be aware of their WBC, their white blood cell count, and ask specifically what's your differential, because although your white blood cell count may be normal, that differential, something may be off. And then the comprehensive metabolic panel, it's the basic metabolic panel, but also includes like liver enzymes and protein levels and calcium. Your vitamin D level, it's vitamin D25 hydroxy. Just double check that if someone says it's normal, is it close to or at least 45? And that's the same thing as with your TSH, that thyroid stimulating hormone level. Try to get it to, or not try to get, but ask if it is normal. Is it close to 1 to 2? And when it comes to hemoglobin A1C, that's looking over a 3-month period of how your blood sugar control has been. So really have an idea of like, oh, yes, it's normal, but your blood sugar is rising. If it's in like the 120s or upper 100s, just make sure that A1C is less than 5.5. And then B12, it's at least at 1,000. So if you take A, then make sure to take B. So these are just some common medications that are prescribed: metformin, birth control, acid suppressors for the GERD, reflux, Elavil, Lasix, it's a water pill, a diuretic to help the swelling. Elavil, it helps with mood as well as sleep and sometimes certain nerve pain. And then the narcotics, if you do have pain. And then the antibiotics, the ciprofloxacin, Levaquin, vitamin C, and then you have Bactrim, also another antibiotic. But these prescription medications can make certain vitamins low. So if you can just pay attention to that, as well as ask from your doctor if you need to take any vitamins. So tips for being well, just some basic things that you may know. I just want to reiterate is choose to be your own CMO. You gotta command that things are done and you're heard, as well as you want to be informed in making decisions. So You have your notes as well as you have the medical provider that you can trust, and then the websites that you go to. And make sure you're drinking water, you're moving, so in stretching, you're taking your vitamin D as in Daisy, because it helps with bone strength, but also helps with our mind, memory, and our insulin regulation, so hence blood sugar issues. Omega-3, 6, and 9s. Your vitamin C as in cat, because it can readily be lowered in stress, as well as take that coconut oil and then the apple cider vinegar, and pay attention to your labels, please. When I say labels, the labeling of your food, what you're putting in your body. And one thing when it comes to vegetables, I just love these slides that show chlorophyll and hemoglobin next to each other. And the only difference is that center element. It's either iron for the hemoglobin or magnesium for the chlorophyll. These beautiful components can carry oxygen, for instance, for us humans. And so when we're taking in the vegetables, chlorophyll has been shown to also, there's a nice exchange, and it too can take on oxygen and help our cells so we can just do well and prosper. So I appreciate you stopping by, and just know that you are your ICMO, and just head over to Simply Revered if you would like. I would greatly appreciate it. The place for developing your internal CMO and the desired healthy collaboration between you and your primary care provider. So thank you.